Bismillah ar-Rahman ar-Rahim. I am Dr. Mervat Aboulmaaty, Professor of Cardiology at Shams University and the current President of the Egyptian Cardiac Rhythm Association, ECRA. In this presentation, I'm going to talk about arrhythmia service in Egypt compared to other countries. In Egypt, we have a very big number of population, 100 million population. Compared to the other countries in the Middle East, Algeria, Lebanon, Morocco, and Tunisia. The history of pacing started in Egypt in 1981, started by epicardial pacemaker implanted by surgeons, and then endocardial pacing. We introduced the dual chamber pacemaker, the ICD, the CRT, and the CRT-Ds. However, the number of pacemakers implanted per million population in Egypt is very low compared to other European countries, and it lies here, as we can see in this diagram, in the lowest quintile, in the first quintile. In this graph, we see that Egypt has the highest number of pacemaker implanted per year. This is a study in 2014. However, the number is 38 per million population, and still this is very low. Also, the same applies for CRTs and ICDs in Egypt. Here, we have the highest number of ICD of CRT implanted in the region. However, it is still low. It is 6 per million population. Lebanon has the highest ICD implanted in the region compared to the other countries. Egypt still has ICD 2.7 per million population. In this diagram, we can see that Egypt here lies in the lowest quintile, in the first quintile compared to regarding ICD, and the same regarding CRT compared to other European countries. Ablation started by DC shock ablation of the AV node and his bundle pacing, that in the critical care unit at Cairo University. Then surgical ablation of accessory pathways, and that is also in the same university. Then RF ablation of supraventricular tachycardias and conventional ablation, idiopathic VTs in 1994. Pulmonary vein isolation, 3D mapping using CARTO in Cairo University and Shams University, and then other universities followed. Then ischemic VT ablation and introduction to the Insight technology. Here we can see that the number of cases of ablation per million population in Egypt here is still in the first quintile, which is low per million population. Egypt has a very big number compared to the region of centers specialized in ablation and in EP physicians, but still all this is very low. We have professors from America and Europe come and visit us since 1994. This is Dr. John Onifer coming from the States, and he comes, and since 1994 till this year, he visits us every couple of years or every year in the beginning to help us with new technology, with new pacemakers and with new devices. And he scrubs with us in the lab and helps the young population to understand better electrophysiology. We have our website, the Egyptian Cardiac Rhythm Association, www.epsegypt.com, where we record lectures, videotaped it, and we present it for us as cardiologists and electrophysiologists, and for nurses and technicians, and in Arabic for the general population. We organized the annual meeting of the ECRA, and last year was a very successful one, which was organized by Cairo University, Dr. Hassan Khalid, and he invited the Professor Haziger and Antonio Kernes, and that was a very good achievement. We are interested in education in the ECRA group, and we started an organized course, Basic and Applied Electrophysiology Pacemaker, that was in 2003. And then we developed the Egyptian Fellowship of Electrophysiology by the Ministry of Health, and where the trainees, they study for 3 years, full dedication and attendance in one of the centers, universities or National Heart Institute, and we have the first outcome in 2018. And the exam is after the first year, and final exam after 3 years. It's a computer-based exam, and we test the fellows in the cath lab performing cases and implanting pacemakers. These are some of the fellows. Then we developed education online with the help of intelligent colleagues from Al Haya Cardiovascular Center, and we call it Al Haya Sky High Education, where we give courses online and we test people online. We have 240 visitors on this site. Then we started to do the EP Fellowship Logbook computerized, and we will start our registry very soon. We contributed to the ECRA White Book since 2009, and we are involved with them. We participated in the Euro Observation Research Program in the AF ablation. 5 centers were incorporated. We also are interested in children education regarding their pacemakers and devices, and also for public education, and we make films and cartoons. We cooperate with the ECRA, getting fellowship grants for our young EP fellows, and we have a good number of them educated in Egypt. We also organized live transmission with the help of different universities, started by Ain Shams University and then Al Haya Cardiovascular Center, and the last one was the London VT live transmission in 2018. Here are the candidates attending as if in London. We are part of Africa, and Africa now is very important to help the African people get their service in the arrhythmia. And here is a very important paper published in the JAC 2019, and this showed that Africa needs a lot of service. The green means there is a decent service of EP and ablation in Egypt, Algeria, Tunisia, Morocco, and South Africa. And the red is these areas are deprived of this service. We visit Kenya with my fellows to help the Kenya people get this service through the help of Medtronic. In Africa, the problem of atrial fibrillation is big, and the burden of AF, as estimated in this paper, will be the highest compared to other continents. Well, from the ECRA, our young fellows need a lot. We need to make our center in Egypt, our centers accredited by ECRA in order to get fellows to be trained from Africa in Egypt. We would like to cooperate with ECRA in research and registry. We would like ECRA to help us to organize courses and to get their support in our ECRA 2019 and in Cardio Egypt 2020. We would like to get our Egyptian EP fellowship to be accredited by the ECRA. We would like to share presenting lectures and cases in a webinar organized by ECRA. We wish that one day ECRA exam will be organized in Egypt and the Middle East, and we wish to get free registrations for at least 20 members of ECRA to attend the ECRA meeting. Now you will listen to what Arab countries' people need from the ECRA. Thank you very much.
Assalamu alaikum. I am Dr. Anwar Zurfi, cardiologist from Iraq. I came to Egypt for study and training in the cardiac electrophysiology under supervision of Professor Mervat Aboulmaaty. Due to special situation of my country, we don't have any training center in this field, so we need your support of this specialty. Thank you.
Hello, I am Salah Al-Ahwani. I am cardiology specialist at Ain Shams University Cardiovascular Hospital. I recently joined the Egyptian Electrophysiology Fellowship Program at Ain Shams University Hospital. Actually, we are looking forward for the support of ECRA organization in the activities of the Egyptian Cardiac Rhythm Association and the Egyptian Electrophysiology Fellowship Program. in the form of more extensive workshop and continuous medical education and also training programs all over the country. We have a very good services of electrophysiology done and a lot of activities done by the Egyptian Cardiac Rhythm Association. In the meantime, we are looking for a major issue, which is the accreditation and affiliation of the certificate of the Egyptian Electrophysiology Fellowship Program. And thank you so much.
Hello everybody, this is Dr. Khatra from Kabul, Afghanistan. I'm a cardiologist here and I came to Egypt for the training in EPS electrophysiology and intracardiac devices with Dr. Mervat Aboulmaaty. And due to the situation in Afghanistan, we don't have unfortunately any center to give us training in electrophysiology, as this is a field in cardiology that we need to travel outside our country to have some trainings in this field. Although we have some centers there for training in interventional cardiology, invasive cardiology, such as structural or coronary, but there is no center to have electrophysiology services for the patient there. So this is my message for you to help us regarding this training. Thank you so much.
Assalamu alaikum, Dr. Siha Mahoma from Libya, Benghazi, specialist cardiologist in National Benghazi Cardiac Center there and head of outpatient clinic there. I've got Master of Cardiology from Ain Shams Universities and training in the subspecialty electrophysiology and at hands of distinguished scientist Professor Dr. Mervat Aboulmaaty, because this specialist is not available in our Libyans. And we go there for teaching and learning as responsible for this science. Thank you, sir, for good effort.
Hello, good evening. Ramadan Kareem. I'm Dr. Aboulmaaty Mohammed Ahmed Hamouda from Sudan. I'm a physician and intervention cardiologist in Ahmed Qasim Hospital from 2016 till now. I came to Egypt for training of electrophysiology and implantable electronic devices under supervision of Dr. Mervat Aboulmaaty and the Chief of Electrophysiology in Shams University lecture. Because in my country I have a new CAS lab, Boston Scientific, but unfortunately there is no any doctor training for electrophysiology and ablation. Although I have a many center for intervention cardiology, including percutaneous coronary intervention, PTMC, and congenital heart disease. Most of the patients need for electrophysiology and ablation. I will transfer him outside to Egypt. So my message, although I need help to establish the electrophysiology in my country and to help me for training program. Thank you.
EP Uber is my dream. When an African patient somewhere in Africa had complete heart block and needed an urgent pacemaker, then her doctor will send a message through EP Uber to satellite, where the satellite will send urgent messages to African doctor in a cath lab equipped, and to the company Medtronic to deliver a pacemaker in the cath lab. The patient will move to the cath lab, the doctor and the device, and the patient will receive the best pacemaker in very good time, and her life will be saved by this pacemaker in Africa. The patient will thank her doctor and go home safely.